Using CPAP, brought to you by Emergicare, when your health is on the line. CPAP is an ALS and BLS skill. Both the EMT and paramedic must know how to use the CPAP. And by the way, CPAP stands for Continuous Positive Airway Pressure. Criteria. Patient must be conscious and in severe respiratory distress due to a suspected pulmonary edema or burn inhalation injury. Patient must have shortness of breath with a pulse ox less than 90% while they are on high flow oxygen via non-rebreather mask. Exclusion criteria when not to use the CPAP. When the patient might have a suspected pneumothorax, inability to maintain the own airway, patient has an altered mental status, if the patient is agitated or becomes combative, if the patient has suffered facial trauma or burns, any recent gastric surgery, if the patient has a basilar skull fracture, if there's a high risk of vomiting, also if the patient has signs of hypovolemia, or if the patient has had recent tracheal or esophageal anastomosis, which is surgical reconstruction or connecting two or more of the portions of the trachea, esophagus, or any major blood vessels. Now to use the device. This is the packaging of our CPAP. When you open up the package and lay the CPAP device out, this is what it should look like. On your oxygen regulator, make sure that you have the threaded connector. Go ahead and connect the CPAP device onto that threaded connector. You want to run the regulator between 15 and 25 liters per minute for the CPAP device. Also, on the mask of the CPAP device is an inlet port. You want to connect supply tubing to that inlet port and run that oxygen at 15 liters per minute. After you have the oxygen flowing through the CPAP device, explain to the patient what you're about to do. Then go ahead and place the mask on the patient's face. Make sure you get a good seal all the way around the device. Now, go ahead and place the straps behind the patient's head and have them come down by the neck. You will see that there is a connector at the bottom of the mask on both sides. Go ahead and apply the straps to the mask. And now tighten the straps to make sure that the mask is nice and snug on the patient's face and there are no air leaks around the mask. After you've applied the CPAP device to your patient, reassess, reassess, reassess. Always keep a BVM nearby and ready. Remove the CPAP device and ventilate if your patient begins to have an altered mental status, if the patient is unable to maintain their own airway, if the patient begins respiratory failure and needs to be intubated, or if the device begins to fail. Thank you. This presentation has been brought to you by Emergicare, when your health is on the line.